Stonehenge, where the dewdrops cry and the cats meow. Shrouded in mystery, though with modern carbon dating techniques, one thing is for certain. Stonehenge was not built by the Druids. No, these high Celtic priests were the engineers behind another lesser-known henge, the Stonehenge, which is the setting of our next sketch, where we'll introduce the glucocorticoid agents such as dexamethasone, fludrocortisone, and prednisone. Believe me, it's just as impressive, though it's always overshadowed by Stonehenge, which, let's face it, it's just a tourist trap made up of fallen rocks that coincidentally form a circle. Stonehenge, on the other hand, was a site of ancient Druid magic. During the Gallic Wars in 58 to 51 BC, the Roman army, led by Julius Caesar, conquered the mini-tribal chiefdoms of Gaul and annexed it as part of the Roman Empire. Stonehenge was the site of the Druids' last stand, where they fought the invading Romans as well as some serious inflammation and immune disorders. Let me show you. Do you see the head Druid chieftain wearing that adrenal cap? The adrenal cortex releases all kinds of endogenous steroids into the circulation, including cortisol, a glucocorticoid, aldosterone, a mineralocorticoid, and DHEA, an androgen. This sketch will focus on steroid agents that mimic the effects of cortisol, a glucocorticoid that exerts a wide range of physiologic effects, including regulation of metabolism and immunity. Oh, and see that eerie moon face? It looks familiar, right? In various sketches, whenever we highlight the effects of glucocorticoids, we bring back the moon face, which should evoke an image of the moon facies caused by excessive glucocorticoid administration. The effects of glucocorticoids are mediated by widely distributed glucocorticoid receptors, intracytoplasmic receptors that, once activated, enter the nucleus to regulate the transcription of target genes. So, because these receptors are inside the cytoplasm, we've drawn this receptor scepter here inside the circle of stones. Once bound to our glucocorticoid moon, now this scepter is ready to work its weird Druid magic. The ligand-bound receptor complex is actively transported into the nucleus where it interacts with specific DNA sequences in gene promoter regions called glucocorticoid receptor elements, or GREs. In other words, it's all about affecting gene transcription. This is how glucocorticoids exert their potent anti-inflammatory effects. For instance, once bound to their receptor, glucocorticoids upregulate the production of an inhibitor that blocks the function of phospholipase A2, or PLA2. Yeah, it's the same PLA2 that we highlighted at the NSAID baseball diamond embodied by the phrase "play ball," because PLA2 is the enzyme responsible for catalyzing the first step in the arachidonic acid pathway, which sets off a cascade of inflammatory events. In this sketch, PLA2 is represented by this catapult A2, ready to launch the inflammation pathway at any moment. Specifically, PLA2 releases arachidonic acid from cell membranes. At Sketchy, arachidonic acid is abbreviated AA, depicted here within the structure of the catapult. Once arachidonic acid is released, it's immediately metabolized into several inflammatory and thrombogenic molecules by the enzyme cyclooxygenase, or COX, as well as lipoxygenase, or LOX. Not so fast, though. By inhibiting PLA2 and the release of arachidonic acid precursors, glucocorticoids restrict the ability of COX and LOX to synthesize inflammatory mediators. See this Roman here wielding the pro-slugger bat? It's our recurring symbol for the COX-mediated synthesis of inflammatory prostaglandins. Not today. And this other Roman invader here, brandishing the lacrosse stick, which is our recurring symbol for LOX-mediated synthesis of inflammatory leukotrienes? I don't think so. The mysterious Druid magic is inhibiting all kinds of inflammatory pathways. And that really is key here. We've covered NSAIDs, which inhibit COX-mediated inflammation, as well as leukotriene inhibitors, which inhibit LOX-mediated inflammation. But glucocorticoids go right to the source and inhibit PLA2, that first step that initiates both pathways. Not only that, the glucocorticoid receptor complex directly interacts with other transcription factors such as nuclear factor kappa B, or NFKB. NFKB controls the transcription of genes involved in the production of pro-inflammatory cytokines. So in this sketch, NFKB is represented by this NFKB fiery crossbow, ready to set off some inflammation and immune cell activation. NFKB is a ubiquitously expressed transcription factor that regulates the production of cytokines such as IL-2 and TNF-alpha, the signaling molecules responsible for the recruitment, activation, and proliferation of B and T lymphocytes. So, operating this NFKB crossbow, we've recruited a White Crusader and an Antibody Archer, which are our recurring sketchy symbols for activated T cells and B cells, respectively, thwarted by that creepy druid magic, of course. By inhibiting NFKB and the production of pro-inflammatory cytokines, glucocorticoids are able to exert numerous anti-inflammatory and immunosuppressive effects. This includes inhibiting the recruitment and activation of lymphocytes. NFKB is also responsible for the production of neutrophil adhesion molecules, normally responsible for facilitating neutrophil migration out of the vasculature to sites of inflammation. If you think about it, neutrophils are kind of like the first responders of the immune system. So at Sketchy, neutrophils are represented by neutro first responders rushing to the site of inflammation. And in this scene, this glucocorticoid druid sorcery is warding off these ancient Roman EMTs. They try to cling to the wall, but they're knocked back and congregate below. By inhibiting NFKB-mediated gene transcription, glucocorticoid agents cause demargination of neutrophils previously attached to the vessel wall. Therefore, circulating neutrophil counts will increase following administration of corticosteroid agents. Keep that in mind when your patient's CBC comes back and looks a bit off. Seriously, this is a tricky thing because you're going to see these drugs a lot. That acute elevation in white count is not due to a bacterial infection, my friend. While the ability of glucocorticoids to inhibit neutrophil migration to tissues contributes to their anti-inflammatory and immune suppressive properties, remember that this comes with an increased risk of infection. That neutrophil concentration won't be the only cell count that's out of whack, however. Pretty much every other leukocyte level will decrease. For instance, corticosteroids reduce peripheral lymphocyte counts within minutes as a result of inhibition of immunoglobulin synthesis, stimulation of lymphocyte apoptosis, and lymphocyte redistribution into the spleen, lymph nodes, and bone marrow. To illustrate these falling T cell and B cell levels, we've sketched in a cytotoxic T cell crusader, a helper T cell squire, and a B cell archer tumbling down into this chasm. Glucocorticoids are especially effective at decreasing the number of circulating helper T lymphocytes, limiting their ability to migrate to the sites of antigenic stimulation. This makes glucocorticoids very useful as immunosuppressants in organ transplant patients. Eosinophil counts also decrease significantly with administration of corticosteroids. So, falling into the abyss, we've also included our recurring sketchy symbol for eosinophils. The biload mask-wearing slingshot specialist, with pink eosinophilic granules, of course. Reducing the eosinophil count can be useful when treating allergic conditions such as asthma. So, because of their suppression of cytokines, prostaglandins, and leukotrienes, as well as their profound effects on the concentration, distribution, and function of leukocytes, glucocorticoids dramatically reduce the manifestations of inflammation, as depicted by this carving of the glucocorticoid moon eclipsing an inflammatory sun. Steroid agents are widely useful therapeutically in inflammatory disorders such as gout, rheumatoid arthritis, asthma, and inflammatory bowel disease. Also, see this crack running down the mystical writing carved into the henge? Looks like some kind of immune globulin glyphs. As a result of their suppression of antibody production and helper T cell function, corticosteroids such as prednisone are useful for managing numerous autoimmune disorders such as lupus, vasculitis, polymyositis, dermatomyositis, and the list goes on and on. Glucocorticoids also exert potent metabolic effects. This includes peripheral antagonism of the effects of insulin. Remember that insulin is the main anabolic hormone of the body, and at Sketchy, insulin is symbolized by a welcome inside mat. Just think of welcoming sugar and fat inside of cells. So as this Roman invader here struggles to open the door behind the welcome mat, let it remind you of the insulin resistance caused by glucocorticoids. Blocking the effects of insulin contributes to the development of hyperglycemia. So, on top of this religious monolith erected by the Druids, we've sketched in an elevated jar of sugary candy, an offering to the most prominent Druid deity. Glucocorticoids are also potent stimulators of liver gluconeogenesis, amplifying this increase in serum glucose levels. To represent increased hepatic glucose output, we've sketched in a Druid at the base of the statue, in the middle of some kind of religious ritual, I think. producing sugary sacrificial candies out of this liver-shaped bag. Remember, glucocorticoids are acting on nuclear receptors to modulate gene transcription and protein production. Specifically, they work to increase the production of key gluconeogenic enzymes in the liver. However, besides liver glucose output, glucocorticoids also increase liver glucose storage in the form of glycogen. See this other liver-shaped candy jar here on this altar of sacrificial offerings? Notice that it's packed with stores of sugary sweet glycogen candies. Overall, think of glucocorticoids as your body's stress hormone. By increasing the production of the enzyme glycogen synthetase in the liver, you can increase your body's glycogen reserve in times of stress. And by upregulating the enzymes involved in gluconeogenesis, more glucose is available for your brain. In fact, cortisol, the endogenous glucocorticoid released from the adrenal gland, exerts numerous physiologic effects vital for maintaining metabolic and circulatory function during times of stress. This is especially important to keep in mind when managing patients with adrenal insufficiency due to Addison's disease, a chronic endocrine disorder in which the adrenal glands do not produce enough steroid hormones. In these patients, even minor noxious, traumatic, or infectious stimuli may produce acute adrenal insufficiency with circulatory shock and even death. This fainting hypotensive druid here represents such times of adrenal crisis, as evidenced by that cracked glucocorticoid moon. Let it remind you of acute adrenal insufficiency when large amounts of exogenous corticosteroids must be administered immediately. Adrenal crisis can also occur in patients taking chronic steroids when they abruptly stop taking them. Long-term glucocorticoid administration negatively feeds back on the pituitary to suppress release of ACTH. Less ACTH means decreased stimulation of the adrenal cortex and leads to adrenal cortical atrophy. Look closely at his adrenal cap that's fallen from his head. Looks kind of shriveled and insufficient, right? So when these patients encounter trauma or major surgery, watch out. They are not making enough of their own cortisol to deal with that extra stress. Bump up that steroid dose. All right, it's time to mention a few important adverse effects of all this glucocorticoid administration. To provide the substrates for gluconeogenesis and glycogenesis within the liver, glucocorticoids promote catabolism at peripheral tissues. Their effect at skeletal muscle, for instance, is predominantly proteolytic. Just think of this Roman invader here toppling over these offerings of protein-rich hams. Also, glucocorticoids promote lipolysis at adipose tissue, hence all the falling stores of lipid-laden donuts. With long-term use, the numerous catabolic effects of glucocorticoids can cause an iatrogenic Cushing syndrome that includes muscle weakness, skin thinning, impaired wound healing, osteoporosis, and immunosuppression. At Sketchy, whenever we want to highlight Cushing syndrome, we include a large cushion, like this one here, incorporated into the statue of this Cushingoid druid deity. In the face, rounding, puffiness, and fat deposition manifest as the classically described moon facies. Similarly, fat tends to be redistributed from the extremities to the trunk, and hence the obvious central adiposity of this druid supreme being. The continuing breakdown of protein and diversion of amino acids to glucose production leads to myopathy, muscle wasting, and proximal weakness, as evidenced by the disproportionately thin extremities. Glucocorticoids also inhibit fibroblast proliferation and collagen formation, making the skin more susceptible to damage from even minor trauma. See the discolored stripes on this fine cloth that adorn the statue? Purple striae are one of the classic clinical manifestations of the skin change, along with impairment of wound healing. The connective tissue that supports capillaries is also thinned, leading to capillary injury and bruising from minor trauma. Keep in mind, this can be seen even with topical corticosteroids used in allergic dermatologic conditions. Glucocorticoids also decrease bone mass by multiple mechanisms, such as decreased gastrointestinal calcium absorption, increased renal calcium excretion, and direct inhibition of osteoblast bone-forming activity. Just take a look at this osteoporotic altar collapsing under the weight of this disrespectful Roman, complete with a pathologic leg fracture and everything. Because of these effects, patients on glucocorticoid therapy should receive calcium and vitamin D supplementation to prevent osteoporosis. Chronic glucocorticoid use can also cause osteonecrosis, usually involving aseptic necrosis of the hip. High doses can sometimes cause corticosteroid-induced psychosis, which can manifest as hypomania, confusion, or hallucinations. That's why the head of the statue is cracked and the eyes look a bit, acutely psychotic. The neuropsychiatric symptoms generally resolve with discontinuation of therapy. The last side effect to mention, hypokalemia. It turns out that steroid agents such as cortisone and hydrocortisone exert mineralocorticoid effects in addition to their expected glucocorticoid effects. This leads to sodium and fluid retention with increased potassium excretion, similar to aldosterone's effect on the distal nephron. This can lead to hypokalemia, as represented by our recurring sketchy symbol, the old potassium-depleted banana peel. And one last thing, you see that cane up there? Yeah, that's our recurring sketchy symbol for immunocompromised patients. We've already talked about the various mechanisms that lead to immunosuppression, but I just want to quickly remind you of an important consequence of inhibiting leukocyte function. In the setting of chronic glucocorticoid use, latent infections can reactivate, such as pulmonary tuberculosis, as represented by our recurring TB cacti, which resemble lobes of the lung. Notice, too, that it's the upper lobes that contain cavitary lesions, which is characteristic of reactivated TB. All right, it looks like it's that time once again. Let's sum up this sketch. Just like the cortisol moon activating that druid scepter in the circle of stones, glucocorticoids activate intracytoplasmic receptors and enter the nucleus to regulate gene transcription. One of the upregulated genes is an inhibitor that blocks the function of PLA2. No PLA2, no arachidonic acid produced. No arachidonic acid, say goodbye to COX-mediated synthesis of prostaglandins and the LOX-mediated synthesis of leukotrienes, as we've depicted by the thwarted Roman soldiers brandishing the prostaglandin pro-slugger and leukotriene lacrosse stick. The glucocorticoid receptor complex also interacts with NFKB, represented by the NFKB fire crossbow. No NFKB, no inflammatory cytokines. No inflammatory cytokines, you're going to have some pretty inactive T cells and B cells. Not only that, NFKB is responsible for the production of neutrophil adhesion molecules. So, just like those neutrophil first responders being prevented from entering the henge, neutrophils are unable to migrate to sites of inflammation. Instead, they accumulate in the circulation, so look for that increase in neutrophil count following the administration of glucocorticoids. Pretty much every other leukocyte count will decrease, including your cytotoxic T-cell crusaders, your B-cell antibody archers, your eosinophil granule slingers, and most significantly, your helper T-cell squires. Besides their anti-inflammatory and immunomodulatory effects, which are helpful in numerous inflammatory and autoimmune disorders, glucocorticoids also exert potent metabolic effects. This includes antagonizing insulin, depicted by the welcome inside mat in front of that locked door, as well as an increase in liver gluconeogenesis. Both these effects lead to hyperglycemia. However, aside from increasing glucose output, glucocorticoids also increase glucose storage, specifically in the liver as glycogen. Hence the glucose-laden liver-shaped candy jar, an offering to that creepy moon-faced god. To provide substrates for gluconeogenesis, your body promotes catabolism at peripheral tissues, including skeletal muscle, as shown by the falling meat offerings, and adipose tissue embodied by the falling fatty donut jar. Long-term use of corticosteroids can lead to Cushing's syndrome, hence our glucocorticoid deity sits atop a cushion. He's also got that puffy moon face, central fat redistribution, obvious muscle wasting, and that thin, sheer striae cloth. Glucocorticoids can also lead to corticosteroid-induced psychosis, and that's why this deity's got those googly eyes. Osteoporosis may develop with chronic use, and don't forget hypokalemia as well, due to those nonspecific mineralocorticoid effects. Think of cortisol as your body's stress hormone. If your patient suffers from adrenal insufficiency as depicted by the broken cortisol moon face, They won't make enough cortisol during times of stress, leading to hypoglycemia and cardiovascular collapse. So get that man some steroids. Remember too that chronic steroid use leads to adrenal corticoatrophy, hence the shriveled and fallen adrenal cap. So when these patients encounter trauma or major surgery, watch out. They are not making enough of their own cortisol to deal with that extra stress. You have to bump up that steroid dose. Though the Druids were eventually defeated and ousted from their homeland, Stonehenge still stands to this very day. So the next time you're taking a road trip to Stonehenge, sure, stop, take pictures, buy a little henge keychain or whatnot. But then look off into the distance at dusk under the harvest moon, and you might catch a glimpse of the remnants of that old Druid temple, and you feel your immune cells plummet from that old Druid magic that still lingers.